Greetings, I'm Jed Shlackman. I work as a holistic mental health counselor, which includes working with hypnotherapy and energy healing and other mind, body, and energetic modalities. In today's video, I want to speak about the topic of mental focus and brain energy in the context of what people often refer to as symptoms of ADHD, and the comparison between using the heavy metal detox smoothie versus using stimulant drugs as a tool to try to address those patterns or symptoms. So first I'll speak about the heavy metal detox smoothie. This is a formula for a smoothie that's been presented by the author Anthony William. He's known as the medical medium. So the story behind his books and his information is that since the age of 4 years old, he's been contacted by the spirit realm. There's a consciousness or being that he refers to as spirit of compassion that relays to him information about the health of people around him and about health topics in general, how to support people who are healing from chronic illness and other conditions. So as part of that information, he presents a smoothie recipe which is designed to combine a specific set of ingredients to help safely and smoothly detox heavy metals that have built up or accumulated in the body, especially in the brain and nervous system, where heavy metals often tend to collect and disrupt the signaling, the communication in the brain and between the brain and different parts of the nervous system. According to Anthony, people with autism and ADHD, what are commonly called neurodivergent now, tend to have those symptoms being triggered by that accumulation of heavy metals in the brain. That's not to say there aren't other factors that are contributing, other stresses, other things that fuel the body to react to things or respond to things by depositing the metals there. But he's certainly stating that the metals are very much associated with ADHD as well as the autistic spectrum. So we're going to review what the ingredients for that smoothie recipe are. What are the components that are included to help clear metals from your body? So one of those components of the smoothie is cilantro. Cilantro is an herb and it has a certain unique flavor to it, and it has been shown in many different studies to be a valuable means for reducing the amount of heavy metals accumulated in the body. So it helps chelate metals from the body. So that's the first ingredient, cilantro. The second ingredient is barley grass juice powder. So the barley grass juice also plays a valuable role in nourishing the nervous system and cleansing the nervous system. Another important ingredient in that smoothie is dulse, Atlantic dulse, the seaweed, and that has some important minerals in it that help draw the toxic minerals out of the body, and doing so in a relatively safe way so they don't get deposited in some other tissues. So we have the cilantro, the barley grass juice, the dulse, and then we have spirulina. Spirulina is a blue-green algae, and it's got lots of dense nutrition in it. It's a high protein source. It's got the omega-3 fatty acids in it. It has an analog of vitamin B12, and it has chlorophyll in it, and selenium. It's something that people use as a source of supplemental nutrition for other reasons, but in this case it works as part of this formula to clear heavy metal toxins from the body. So that's the fourth ingredient, and then the fifth ingredient is wild blueberries. Wild blueberries are usually sold in a frozen form, so you can get them in grocery stores frozen. They don't sell them fresh unless you perhaps happen to live in the region where they're grown, but otherwise in grocery stores you'll find them frozen. And the wild blueberries are very high in antioxidants and particular plant compounds which help remove toxins from the body, which protect the brain and nervous system. So that's a more powerful form of blueberries for this healing purpose than just the ordinary blueberries that you would see fresh in a grocery store. So we have those 5 ingredients for the smoothie, and you could use a very pure base for your smoothie. So you might just have some coconut water, you might have some bananas or apples or pears or some other fruit blended into that fresh. So no other added ingredients, no added sugars or sweeteners, no added oils, no protein powders added, no collagen added, nothing else. Just those 5 metal detox ingredients and your fruit juice base or coconut water base. And that's something you could use every day as part of your health routine, and doing that over a period of time would tend to dramatically reduce the amount of heavy metals that are accumulated in your body tissues, and in particular in the brain, which is our concern if we're thinking about mental focus and brain energy, the ability to think, to use your executive function, your frontal lobe of your brain, which is the one that's the more active thinking part of the brain, which you need for sustained focus, for intellectual activities, etc. So that smoothie, that detox approach, will tend to build upon itself over time. As you continue to do that, things will get clearer and clearer in your brain. The signaling there, the functioning of those circuits in your brain will continually improve, and there's really no drawback, no negative side effects from doing that smoothie. Next, we're going to consider the pharmaceutical medicine approach that attempts to improve mental focus or alertness, and that's using primarily stimulant medications. So you may be familiar with different common medications that are prescribed for people who've been given a label of ADHD, things like Ritalin and Adderall, Strattera, Vyvanse, Dexedrine. You also have people using herbal stimulant drugs, things that aren't prescribed, but things you might just get over the counter, including various caffeine-based formulas or just plain coffee. So those are stimulant chemicals. What they're doing is stimulating your body into a kind of alert, almost like a fight or flight state, where you're hyped up to be alert, to focus, to direct your energy toward the task that's in front of you, something that's important or relevant in the moment. So it's kind of like waking up that part of your nervous system that you're using when you're trying to focus and perform cognitive, mental type tasks. Many people use stimulants to stay up late and study when otherwise their body would naturally want them to rest and relax and sleep, so that the nervous system and the body can refresh and replenish. So if you don't allow your body to go through that restoration and balancing process, you're going to end up kind of crashing. You'll end up more depleted than you were before you took that drug. And the more you do that over time, the more you may be damaging your nervous system, making the underlying deficit or disturbance even worse. So people that are kind of already overstimulated, overstressed, overanxious, and having difficulty focusing or concentrating as a result of that, giving them a stimulant to temporarily focus, it may for the short term, very briefly, help them perform a task, but it's actually making that deeper underlying problem aggravated or worse. And if you continue to do that, it can lead to various other mental health issues, worse anxiety or depression or psychosis. So it can lead in a negative direction rather than leading to long-term improvement and restoration of healthy brain function. So the medication route is built upon the premise that someone is somehow lacking in a particular neurotransmitter, and forcing the body to elevate the level temporarily of that neurotransmitter is something helpful or therapeutic, when in the reality, if you look at it long term, you're actually likely to further impair the body's ability to self-regulate and maintain the optimal levels of its neurotransmitters. So that often leads to drug dependency, where the person feels dependent on the drug just to function at a baseline level, where if they don't take the drug, they go through a withdrawal where they feel even worse or function even worse than they did before they ever started that treatment. That occurs fairly often. So that's a pretty big risk to take when there are other ways to approach and address mental focus and brain energy concerns. Working with diet and nourishment and detoxification, also emotional detoxification, so reducing and relieving stress, healing traumas, overcoming insecurities and anxieties, issues with self-confidence, improving your sleep habits, getting more physical activity, more movement and exercise, spending time outdoors in nature where you get to breathe fresh air, which improves the oxygenation of your body. And of course, the sunlight. Light therapy is something that more and more is recognized as a way to boost our body's metabolism, to improve the functioning of really everything, including the brain and nervous system. So you can work with nature, with natural foods like fruits and herbs. You can use exercise and sunlight. All these relatively free natural resources are there for us, and those can safely help improve our mental focus, improve our energy, our brain's ability to function optimally, rather than using chemicals to temporarily force our brain into a particular pattern of activity or focus. You can use drugs to force the brain into that kind of hyper-focused or hyper-alert state. Stimulants, you could also use other types of medicines for opposite type effects to calm or numb the nervous system. Those are often used for anxiety reduction, for stopping thoughts that are disturbing, so treating so-called psychotic symptoms. And some of those medications are even more dangerous than the stimulant medications used for ADHD. So whatever the mental health diagnosis or pattern might be, it's really inherently hazardous to attempt to suppress symptoms or force the brain into any particular pattern. That's what psychiatry has been focused on now for a number of decades, but we see the outcome is that people's mental health is deteriorating, not improving. Overall, people seem to be getting worse and not recovering from these various mental health diagnoses. So a different mindset or approach, a different paradigm is something we really would be wise to consider if we want to truly help people rather than giving them treatments that are actually quite risky and harmful for many. This discussion is presented for educational purposes, so I'm not here to provide any medical diagnosis or treatment for anyone's individual mental health concerns or any other health concern. This is just additional information and insight for you to consider when you pursue your own healing or treatment path, when you consult your own physicians and healthcare providers. If you're interested in this subject and other aspects of holistic health, I invite you to visit my website, phinsights.com. That's phinsights.com. If you're interested in the heavy metal detox smoothie, you can look up the Medical Medium books by Anthony William. He has multiple books that refer to that recipe. And if you're interested in brain energy, a look at metabolism and its role in mental and physical health, you can find the book Brain Energy by the psychiatrist Chris Palmer, MD. For now, I'd like to wish everyone a wonderful day. Namaste.